You're welcome to our interview today with Dr. Fozard, who's practiced here for many years. And I've been here just a short time, and I found just in the short time I've been here, very educated, very well knowledge in person, very professional, and has a very good following of patients in the community. So with that, welcome Dr. Fozard.
Thank you, Mr. Dauby.
Tell us a little bit about your background. I know the medical school and residency programs that you went through. And
I did undergraduate work at Washington University in St. Louis, and then went to University of Illinois for medical school. First year in Champaign, which was a pilot program. There were 10 of us working together out of a little White House. It was a new concept to teach basic medical science through disease instead of just going in and studying anatomy and then physiology. We'd study a disease process, peptic ulcer for GI tract, heart attacks for circulatory system, and from there I went on to Chicago for 3 years, a little bit more traditional. And residency was in St. Louis at St. John's Mercy for 3 years in family medicine.
okay, so you've been practicing now, look, January 31st of this year, 43 years.
Yeah.
So just not too long ago here, it's just February the 31st, just 43 years, that's great. So when you were born and raised in the area and you came back to
Yes.
Pinckneyville, so what was that decision? Because there's so many opportunities in medicine, and even more today than there were probably back then, but physicians at that time getting their school and residency programs tended to go and stay and settle in one place, and now today's physicians are always looking for the next best. So with you, what drove you to come back and stay and practice here?
Well, I'm from Southern Illinois. I grew up in Carbondale. My dad had a drugstore down there. I worked in the pharmacy from middle of my 8th grade year all the way through college. Decided I was going to go back there. I was going to do family practice at home, and I even spent some time at what was then called the Carbondale Clinic.
Okay.
It's now Center for Medical Arts. Did a summer program there, and that's where I was going to go. And one day, Dr. Dauby, who used to be here practicing, called me up in St. Louis and wanted me to come by. Though I happened to be coming home pretty soon for a weekend to visit, so I thought, well, I'll drop by and just see what they got to say. I'll be nice. And I got here and discovered that I could do what I wanted to. And Carbondale, I talked to people and they'd say, yeah, we'd be glad for you to come here. And the next breath they'd say, well, we take our kids to that nice pediatrician, Dr. So-and-so. And when they have babies, we go to that nice OB guy, so-and-so. And I thought, I'm not going to get to do very broad range of family medicine. And when I came here, I discovered I could do all of that if I wanted to. What I wasn't comfortable with, then I could send off. So turned out to be a very good fit.
So you joined that practice of Dr. Coffey at that time, and with that practice for several years before joining the Pinckneyville Community Hospital practice, correct?
That's correct. I was with Dr. Coffey for 19 years. There were originally 4 of us, and then it dwindled down to just he and I, and he was getting to an age where he didn't want to work as much, and so it turned out to be a good opportunity coming to the hospital.
Good. Well, one of the accomplishments I have to recognize Dr. Fozard for was in 2018, the Illinois National Rural Health Association awarded you with the Physician of the Year in practice. That was a big occasion they had here at Celebrate Hospital. Your family got there. What are the major accomplishments? I mean, do you have any that you are very proud of, or just the fact that you've been practicing and serving the community? Or
Well, it certainly was a great honor to be recognized by a statewide body for accomplishments. I think really the thing that I'm happiest about is having been here as long as I have and developed a very loyal following of people that depend on me, trust me, and look to me for help, and they've become friends all the time I've been here. I think that's probably my happiest part, is to have been able to be a part of people's lives and help them.
we're definitely grateful for Dr. Fozard for everything he does in the community. Like he said, he does have a very loyal following that people will wait to make sure that they get in with you. No matter you're out of town, I'm going to wait till you get back in town for you. But I mean, you still see a few new patients and so forth.
Yeah, not as many as I used to. The number of people got a pretty good number, and it's not really fair to the older folks that I've had for so long to take in too many people, but I do take a few new ones.
Good. So you were also in the Army Reserves too.
Yes.
Tell us a little about that experience.
Well, I'd always been interested in military. I'm a history buff, and joining the reserves appealed to me. My friend here in town, Dr. Grasso, who's on the hospital board, that was in the reserves, and we talked quite a bit about that. So I finally decided to join up. We were in a hospital unit doing physicals for reservists. They're every 4-year physical, 2 Wednesday nights a month and a Saturday or Sunday a month, going to St. Louis. I enjoyed that, and after 2 years, Desert Storm broke out. And he and I got an all-expense paid trip. I got to go overseas. He had to go to Fort Polk, Louisiana. I was actually wound up overseas with a guy who was at Fort Polk with Dr. Grasso, and he volunteered to go overseas to get out of Fort Polk because how bad he hated it. But I was in Saudi Arabia, Iraq, and Kuwait for about 3 months.
Okay.
Got there when the ground war started, but fortunately for me, I wasn't involved in any of the ground war.
So as far as the injuries and that, there wasn't a lot at that time?
No, there really wasn't much on our side. The war was over so quickly that our folks really didn't have a lot of injury. We wound up seeing people that were having heat exhaustion, upset stomachs, aches and pains and strains and whatnot. So a lot of reading time. So I don't wish for reading time anymore, because sometimes you get what you wish for and it's not always what you thought it was going to be.
There you go. You did mention that you're a history buff, and I know Civil War is one of those that you really have you gone out to various schools and so forth with kind of live demonstration of the soldier and talk about that. So that's really up your what you really desire and what you really like to do. So tell us a little bit about that. How did you get into that?
Yeah, I've been interested in history as long as I can remember. One time I wanted to be a history teacher, and then I got in the pharmacy business and thought that would be fun, and I decided to go a little farther and become a physician. But I do enjoy visiting historical sites. I have a Civil War uniform. I dress up. I bring guns and swords and equipment. Been going to the 5th grade out here at Pinckneyville since my daughter was in 5th grade, and that's been 30-some years. Except for the COVID this last year, I've been there every spring. I've been all over Southern Illinois giving talks, including McLeansboro. Went over there to the Historical Society at one time. So I've done a lot of talks. I enjoy talking about it. It's really, it's fun.
Yeah, I know they have that, so I guess they didn't have it this past year, but they're gonna have a thing now at the Pyramid Park, which is very, very exciting, I understand, on Civil War reenactments, so.
I think that'll be interesting. The one they did have, I happened to be out of town and wasn't able to participate, but looking forward to getting involved in that again.
Yeah. One thing I found also about Dr. Fozard, he's very dedicated to his practice. I mean, he's always the first one in as far as any provider, and he's the last one out. And I go there many times, like at 7:30, he's still in there, and I'm sure Karen would say, you need to come home a little earlier and so forth. But I mean, it just shows your dedication and hard work to the people in the community, and I think that's what you find with Dr. Fozard is he's well educated, as I said earlier. He's devoted, dedicated, and he has a lot of clientele that follow him, and they really trust him, and I think you built that trust, and that's what you expected. I'd say as coming out of physician and working is appealing to the patient and making sure that you're taking care of their needs. So tell me a little bit about that. How you made that perception. How do you practice to get people to really know that they can trust you? What do you?
Well, I think a lot of my patients have been with me 40-some years. Many of them have been together a long time. I think it's important to get to know the patient outside of the office, know what goes on outside the office. A lot of physicians will just come in and they talk about the medical problem and they're in and they're out and they're done. But I like to visit. My wife says I talk too much, but I think that's part of the fun is getting to know the patients, getting to see pictures of children, grandchildren, and whatever, and what's going on in their lives. I think that's important. I always tell people that ask about how long I'm taking, there's no clocks on the wall. I think that's one reason that, most people don't like to wait. They will wait because they know, even though they're going to wait, that if they need time, I'm going to give them the time they need to tell me what they have on their minds.
Right.
So,
and one thing we talked about with some of our other interviews is that still Pinckneyville Hospital is unique in the fact that the providers in the clinic also see the patients when they come onto the floor, and that's something in today's environment that you don't see a lot of, because there's a hospital doctor, hospitalist that goes see the patient, and the clinic doctor stay in the clinic. So that's pretty important to you to be able to follow your patients on the nursing floor.
I think it's really important. I know them better than the hospitalist does. He sees them for a short period of time. He doesn't really know anything about them. I know that their mom or dad had this or that disease, or even some of them grandma, because I've taken some care of some 3 generations. Again, nobody knows them better than I do, so I think it's important, and the patients enjoy seeing the same provider, the same familiar face, somebody that they trust and that knows about them. I think that's really important to have the continuity.
I think it's really also important in that same aspect that with patients that come here, maybe they need a higher level of care. So maybe they go to Carbondale or St. Louis for the high level of care that we may not offer here, but yet they could come back into our transitional care swing bed program and still be followed up by you or the other providers, which is a great benefit because you know them in a clinic, and then you also get to see them when they come back. And when people go off to St. Louis, they want to get back to Pinckneyville, they want to get back home, and our transitional care beds offer that ability to come back home. So
yeah, they really do. It's a very good service, and the patients appreciate being able to be back home. It's easier on family; they don't have to travel.
Yeah. So we talked about how hard you work and dedication to that. We talked about your being a history buff. What is your getaway? I mean, is the history, or you leave here sometimes 7:30, but so do you have time to do any kind of other hobbies?
A little bit. I enjoy working outside. I like planting flowers, doing a little bit of gardening. I just love to play in the dirt.
Yeah.
A few years ago, I took up archery, and don't do a lot of it, but in the backyard, I can shoot some arrows whenever I got time. Took up sport clay shooting about 3 years ago. I haven't been a lot of times, but it's a lot of fun. My son and I do that when I go to Colorado to visit, and I have a friend here that's been real good in instructing me. He's very patient.
But also, just moved out in your neighborhood, I also see you running a lot.
I like to run. I try to run about 3 days a week. Helps me stay in shape, helps me relax. Do a lot of good thinking, come up with a lot of good thoughts, have a lot of good arguments. I always win.
There you go. You be by yourself, you can come up with your own thoughts and ideas and agree with you or disagree with yourself.
Yeah.
Well, we're here today talking to Dr. Fozard, who's been here at Pinckneyville for 43 years, is very dedicated, loyal. His patients are very dedicated and loyal to him, and we're just grateful to have him. He's been very, very excellent physician for our community. We should be honored as a community to have him here, and we always keep telling him, you're not going to retire though, you're going to keep practicing yet, because there's so many people that wanting to continue practicing, so we're really grateful to have you here. So anything else that that comes to your mind that you'd like to tell us about yourself or about the hospital or anything?
Well, I think we have a very good facility here, especially with the new hospital. Everything on one floor is much better than the old facility, and we have such a wide range of services that we can provide here. The new physical therapy building is really nice. Senior Life Solutions. We have an excellent ER, and I think we have some of the best nursing staff in the area. I continually get compliments about our nursing staff, how much better they are than the big city. Go to St. Louis, to even Burns or Washington, or to St. Louis U, wherever, they don't see nursing staff and they don't get taken care of, but here they get personal care, and the patients really appreciate that.
True, loyal, rural care that you just don't get, and you don't see that. And I was talking to some people the other day about how you go to St. Louis and you're supposed to schedule for a CT and you never know when it's going to be, and well, I'll get that next week, and here you probably get it that day or the next day, so it's just so much advantages of having rural medicine that people sometimes overlook, but people in the rural community understand that, but the city, they don't really understand the rural medicine. So again, I want to thank Dr. Fozard for joining us. The clinic here in Pinckneyville at the Family Medical Center, 357-2131. We have a lot of great providers along with Dr. Fozard. We were just grateful for him to join us today, and we're grateful to have you here.
Oh, thank you, Randy.
Thank you very much.